Hello everyone, this is Mr. Matus and I'm here to discuss with you the differences between right-sided versus left-sided heart failure. In the NCLEX, you'll be encountering questions about heart failure, and usually they focus on the differences between right-sided and left-sided heart failure. So our focus today is to find out why is it that patients with right-sided heart failure have different symptoms compared to patients with left-sided heart failure. So let's go to our presentation. So this is just the anatomy of the heart, the structure. And the reason why we have this in our slide right now is because to understand the manifestations or the differences between the signs and symptoms of right-sided versus left-sided heart failure, it's highly important that you know the blood flow and the structures of the heart. So remember that your heart has four main chambers and two sides. So you have the right atrium on this side over here, and then the right ventricle on this portion over here. Then you have the left atrium over here, and then you have the left ventricle over this side. So you have to remember that the blood coming from the different parts of the body, from the head and from the lower extremities, the unoxygenated blood enters the superior vena cava and then also the inferior vena cava, and then it goes to the right atrium and then to the right ventricle, and then that blood is being pumped into the lungs. So you will understand that whenever there is a failure of the right ventricle, what happens is that the blood goes back to the systems, and that's why it's causing edema, it's causing liver cirrhosis, it's causing splenomegaly, for example. Now on the left side over here, you have the left ventricle. So the blood that comes from the lungs enters the left atrium and then goes into the left ventricle, and then that blood is being pumped into the aorta in order to distribute the blood to the whole body systems. So when there is failure of the left ventricle, the blood goes back into the pulmonary system, and that's causing the patient to develop pulmonary congestion or pulmonary edema, and then that's causing the person to develop left-sided heart failure, which is primarily manifested by pulmonary edema. So what I would like you to remember is that for those patients with failure of the right ventricle, that leads to systemic edema, and for those patients who have failure of the left ventricle, that leads to pulmonary edema. So let's go over the signs and symptoms of both. So you could see here an illustration of the differences between your right-sided heart failure and your left-sided heart failure. So you can see that for your right-sided heart failure, you could see systemic congestion as the primary manifestation or problem. For your left-sided heart failure, the primary problem will be pulmonary congestion or pulmonary edema. So here, for right-sided heart failure, you could see manifestations like distended jugular veins, anorexia and nausea. You also have hepatomegaly, which is the enlargement of the liver, and this also leads to the development of cirrhosis because of portal hypertension. Then, because of the cirrhosis of the liver, that leads to ascites, or the accumulation of fluid in the abdomen or peritoneum of the patient. Now, because the blood goes back into the system, it also causes the patient to develop splenomegaly. Another manifestation for right-sided heart failure will be edema in the ankles, the feet, and the sacral area. And lastly, because of the increased pressure on in the right side of the heart, that leads into an increase in the central venous pressure. So the pressure that's increased for right-sided heart failure will be central venous pressure. Okay. Now the manifestations of left-sided heart failure will be mostly related to hypoxia because of congestion of fluid in the lungs that affects the gas exchange. The primary manifestation of a patient with left-sided heart failure will be dyspnea or shortness of breath, paroxysmal nocturnal dyspnea, which is the dyspnea that happens at night because the patient is lying down and then the fluid accumulates in the pulmonary system, causing the patient to wake up and even sometimes drowning in his own secretions. Another manifestation is orthopnea. Patients with left-sided heart failure will have problems lying flat because of fluid accumulation in the lungs, and that affects their ability to breathe. So a lot of these patients with left-sided heart failure, they need to elevate the head of the bed so that they could breathe better. One of the things that you really have to see or to take note in the NCLEX will be the appearance of the sputum of the patient with left-sided heart failure. And the common characteristic of that will be, remember this, frothy, blood-tinged sputum. So this is a characteristic sputum of a patient who's having a pulmonary edema. Another one is crackles or rales, the characteristic lung sound that you will hear during auscultation because of the accumulation of fluid in the pulmonary system. Now, the pressures that will be increased in the pulmonary system will be, or in left-sided heart failure rather, will be the pulmonary pressures, namely the pulmonary artery pressure and the pulmonary capillary wedge pressure, which can be measured by a Swan-Ganz catheter. So I would like you to see the contrast between the two types of heart failure. So in right-sided, what you see, and then the left-sided also what you see. Especially on the right-sided, you could see more of systemic congestion, particularly in your gastrointestinal system. And for your left-sided heart failure, that would be the congestion in the pulmonary system. And left-sided heart failure is characterized by pulmonary edema. Now, I would just like you to remember also that when in the NCLEX you see the situation or the condition, it mentions acute pulmonary edema. That is kind of like a different situation. When the patient has acute pulmonary edema, adding the word acute, that means that it's a sudden and severe accumulation of fluid in the lungs of your patient, and which may signify that the patient is developing advanced or severe form of heart failure. So the heart is really failing, and the patient may need to have an increased dose of digitalis medication. And so the emphasis there is that acute pulmonary edema is a form of emergency. So these are the differences between your right-sided heart failure and your left-sided heart failure. So I hope that this is a very good review, just a quick review of the differences, and you will be able to answer the question correctly whenever this comes out in your NCLEX. And before I end today, I would just like to give a shout out. My book has come out in Amazon, and you can order my book, and the title of that is Simple, Fast, and Easy NCLEX Review. It's your ultimate study guide for passing your NCLEX-RN and your NCLEX PN. And the one of the main advantage of this book is you will be able to learn nursing concepts in a simple, fun, and easy way and pass your NCLEX. So I encourage you to order your copies. You can just go to Amazon and then you can order. And I'll be very happy also to hear your feedback if you could write a review in Amazon, how you find the book. And so far I have students who have purchased the book and have really received very good feedback because they find it very simple and it's not overwhelming. So thank you very much everyone for watching my video today, and if you like my video, you can click like or share or subscribe to my channel. And also you can visit my website at www.matusnursingreview.com. Thank you very much everyone, and have a good day.